How many of you remember about the body of knowledge? Do you remember the body of knowledge? I mean, discussion about, yeah? Well, she mentioned that it is very important that a profession has have this body of knowledge, because this knowledge defines the profession and are the basis, the foundation of the profession, that body of knowledge. And she said that I can test your attention. Who is responsible for the body of knowledge? Responsible of the data, which are the basis, the Romanian government, Ministry of Health. Who? Louder, please. Who? The dietitians, because the profession of dietitian, yeah, the profession is responsible for the body of knowledge, and I believe we should teach all the professors in Tîrgu, Mureș, when they say those who are in charge with the population nutrition, they should say dietitians. I believe this project has a lot to do with starting with us as dietitians should start gathering the data, which are the foundation of our profession. As the others, I'd like to remind you, just a little reminder for those who have visited Herghelia or who will visit it. It's a non-profit organization. I'd like to thank all my colleagues for what they are doing, for what they have done, and this study would not have been possible without their contribution, and also financial one. When you start a project, it means that there is a need you have to meet, which is not invented, which screams at you, and most of all, the most obvious needs are those which are not addressed. Trouble is, in Romania, we have somewhere between 55 and 60% proportional mortality by cardiovascular diseases, and which places us, our place ranges, I don't know where we are leading, so to speak, in this. Part of this is due to cardiovascular disease. Very often on the death certificate it says heart failure or something, but the metabolic syndrome was behind this. When we speak about cardiovascular disease, we speak about ischemic heart disease, stroke, arrhythmias, heart failure, and high blood pressure. It is about the fact that 5 in 10 people die from cardiovascular diseases, which is a real issue. Pika Puska was saying that a mass epidemic calls for mass action, and the changing of lifestyles can only succeed through community action. Maybe the students, the master's degree students, understand which they have 2 hours weekly of community action. Dietitians need to be involved, and you will see why. Fortunately, we don't have to invent the wheel again here in Romania, but it would mean that this wheel has already been patented. I would like only to give one example. I don't have time to address more examples today. It's in Herghelia, in Finland, there was a community intervention project, and then they did not start with a lot of resources, with a lot of people, but actually it was only through the passion of a certain a few people who had a clear vision and they knew what they wanted to do, and they made a difference as regards mortality and longevity of the Finns. A big difference which is also felt today. Basically, during this intervention program in the community, the mortality by cardiovascular diseases were reduced by 73%, by cancer was reduced by 70%, mainly lung cancer, and by diabetes by 90%. Longevity increased by 7 men in women and 16 women, 7 in men and 16 women. Why Finland? Because when this was started, Finland was on number 1 as regards death by cardiovascular diseases. So they chose Karelia, the area of Karelia, as intervention zone because they had the highest death rates by cardiovascular diseases, number 1 in the world, number 1 in Finland. This happened, it is possible, it is a model. I don't have time to enter more detail. We spoke about networking here, and already our association has started working on this, and I think this conference is a demonstration of the fact that we understand networking and to cooperate with others. And in the afternoon, the chairman of the Heart Foundation will be here, Dr. Dan Gaiță. In order to demonstrate this cooperation, we want to cooperate in this project. Also, cardiologists set the goal that by 2015 to reduce cardiovascular disease by 10%. Professor Dan Gaiță estimated that annually maybe 15,000 people would be saved, which means a small-sized town. When a plane crashes, 150 people die, it's a great fuss. But here, we speak about 15,000 people which could be saved by such a program. The question is whether we've got, now speaking about dietetics and proof, evidence-based medicine, whether they are profitable. I have selected here a few of them. You can have a very rapid impact in less than 1 month, and those of you who went to Herghelia, you saw what the impact was in 10 days on the risk or on the heart attack risk. We know now that in less than one month you can have a big impact as regards the reduction in the risk of heart attack. Simple interventions like decrease in cholesterol. If we apply what we spoke about, there are recurring themes: less fat, less animal fat, more fruit and vegetables. If we apply these simple things, things already look better and cholesterol is going down. What actually is happening is that as regards especially coronary diseases, in a matter of days when you switch to such a diet, the inflammation in the blood of the diseased person is decreased. Even if nothing happens to the artery, it doesn't get enlarged, it's the same lumen, the patient feels better because already there is the inflammation disappeared and the oxygen can be better used. And only later on, having such a diet, after such a treatment, you can see that the artery starts opening little by little, but it starts opening. As for us as dietitians, I consider myself a dietitian. I have 2 or 3 classes that I need to take, and then I can take the exam. It is difficult to take classes. If you didn't participate, this is another story pertaining to our system. I go back to the dietitians. The major risk factors, and this data comes from the Heart Foundation in the United States, the 6 major factors which are known to date on the heart attack and coronary disease. Factors which can be changed: high cholesterol, lack of exercise, smoking, high blood pressure, obesity, and diabetes. 4 of these have a lot to do with dietitians. 4 of them are there where we have the expertise and the knowledge and we can intervene. Then exercise is such interrelated. You took classes on exercise and you know about exercise a lot, and therefore you are the people who are most qualified to work in this SOS Tîrgu Mureș study. You see, there are other important risk factors which could not be quantified because there are so many substances in a fruit or a vegetable. It is difficult to say what happens there, but you see, it's a diet poor in fruit and vegetables. We can speak about alcohol and stress. The dietitians have to build up knowledge, to accumulate knowledge, so that he should be able to do stress management. I think you understood that from what has been said here. Not only fundamental or applied classes are important, you should also do psychology and counseling. Another proof, if we needed any further proof, is continued as 9 of 10 of the potentially modifiable factors, and which lead to more than 90% of the heart attacks, can be changed, can be influenced and controlled, and half of them are explained by diet. Again, how important it is to be a dietitian and have the knowledge that you have. Last night, and perhaps also on Thursday night, there are some data from the randomized study in Herghelia. There are people who are in a different environment from what they have at home or from the general population. They come to Herghelia and eat what we give them to eat. They do exercise. The idea is that it is possible. And this study was done with people from the world, people who are employed. Some of them had some history. Maybe they were ill, but there were also young people who did not suffer of any disease. And it is possible in 10 disease to decrease the total cholesterol by 30%, LDL cholesterol by 40%, blood sugar as well. Today we know that the inflammation is a very important part in cardiovascular disease and rheumatoid diseases. This is a slide which values 10 books, is worth 10 books actually. In Herghelia we did qualitative measurements, C-reactive protein. However, in 10 days, all subjects with abnormal values, they had inflammation, they all become negative, they came to normal. And the diet, and there are a lot of articles, maybe later I'll show them to you. I'd like to give them to you so that you can have them for reference. And there are a lot of articles on this issue. What is the impact of diet in inflammation? And not only in cardiovascular disease, but in rheumatism and in obesity. That's why today we are speaking about a complex disease. I cannot say it. Benefits of reducing risk factors. What are the immediate benefits when you decrease cholesterol? For each percentage of cholesterol decrease is a decrease of 2 to 3% of heart attack. The exercise decreases the risk by 45%, and the blood pressure reduction by 1 millimeter reduces the risk of heart attack by 2 to 3. Every little thing that you do in the community, sometimes it looks like people do not change, and they do not eat from one day to another half their plate fruit and vegetables, but little by little it will make a difference, it will count. What is the main objective of the SOS Tîrgu Mureș, of the community project? Initially, to reduce cardiovascular disease mortality, we are focusing on the most important disease which screams at us the loudest, and then we will focus also on reducing the major chronic diseases. I don't know if you read this, but when the program of health monitoring was done, in adult population, a third of them had a very high risk of metabolic syndrome. And I told you that many people with diabetes do not die because of diabetes, they die because of cardiovascular diseases. Something is going on in our country, and the objective is to address this issue. As interim objectives, there are those to decrease the risk for the main risk factors that I have already mentioned, cardiovascular disease, but in turn are risk factors for obesity, and they are associated to these diseases. Especially the risk factors mentioned here: high blood pressure, LDL cholesterol, blood inflammation, high blood sugar, also lack of exercise and smoking. Actually, the three direction in which we work will be diet, where we are experts, exercise, and quitting smoking. We are national objectives. Initially, it is a pilot project for the entire Romania, and later on a demonstrational national project. Then I'm coming back to your role in this program. There are a lot of data currently available. We don't need more data to say that the diet plays an extremely important role in what I have said, mostly cardiovascular diseases. You are and you will be specialists in what it means to be the dietitians of this country. Many times in classes, I talked to Florina. I was going out to television station, and when I said you will be those who will come live on television and tell people what is the diet to follow, I have never said it, but it is happening. If after this conference you will think positively, and you will not expect the government to treat you as dietitians, you will treat yourself as dietitian, you will get there. And it is never too late to start behaving, acting like a dietitian. Something else which was important in the SOS project, that we will have a shift in focus from adult population to children population. Felicia Ionescu, I would have loved Felicia Ionescu to be here. She is very busy. She is an inspector with extracurricular activities in the school inspectorate, county school inspectorate. She is waiting for us, and not only her is expecting, she expects us to prepare the children to speak to other children, to train them. I think that these are enough reasons, and I won't insist because the time is advanced, why we are focusing on children. Although it would look like we are the wise adults, the children actually decide on our budget, not only as far as food is concerned, but in other things. I will come back to this idea in a minute. This is the slide which is worth a book. Why we would focus on children? Because the cardiovascular disease starts very early in life, during childhood, and this is where we should act. Children decide on the family budget, and we should study as dietitians to cooperate with food industries to do marketing, and they will help us how to do the marketing of this profession as dietitian. Coca-Cola and Pepsi-Cola, they said we don't advertise for children, but signed $1 million advertising related to Harry Potter and Britney Spears. In 2002, McDonald's and Kraft spent $15 billion in advertising, a good portion aggressive, on toy, clothes, books, on all TV channels, especially for children. I don't know, in children, I didn't study it, but I know that in the United States and other countries, maybe here, there are toys, and especially the children, many times children do not go there for the food, but they also eat, but for the toys. They spent the most in the United States in 2003. Children between the ages of 4 to 12 spent for their wishes $30 billion, but their wishes as far as the family budget was concerned was 600 billion. What is the future of this community project? First of all, to diagnose. The students have already gathered 1367 questionnaires, a questionnaire of 107 questions, which especially at the beginning takes a lot of time. When you gather speed, it takes you less, but we also have a second batch of 1200 questionnaires, which were gathered by others, and we'd like to compare. Also from other areas where the students said they are not comfortable, maybe poorer areas, and we worked with another foundation who gathered this data, and when we will put them together, we will have a very clear picture on what people in Tîrgu Mureș are eating, because sometimes statistics and what goes on, they are not very clear, and we don't know for certain. We guess that they eat this or the other, but we don't know exactly. And I suppose we will know pretty sure what they eat. The second step is to analyze and to publish the data, so the students can publish. There is an extensive amount of data. The second step is to consult with partners around the world, maybe partners around the country to write a project for funding. We need funding to be able to do this, and the project will be for at least 5 years. And here again, there is a place where students can help, and of course, the cooperation with EFAD and ADA and others. And the third step would be to act, which is the most important one. Again, we rely on you, and I do believe you will do a very good job, because you are the specialist in nutrition and dietetics in Romania. What do students in other centers do, university centers? Well would it be to have control populations, where we should do the same things which we did here, to see what happens in Timișoara, maybe in Iași, what happens in Cluj. And always when we do it again, because from time to time you do these questionnaires again, and the tests you do from time to time. You are the ones who are involved in gathering the data, and you can cooperate for this study, although you're not in Tîrgu Mureș. And if you wish, you can get involved in the educational side, because what will happen here will have an impact on what's going on in other towns. The doors will be open for the dietitians to get involved in educating children. I'd like in 5 minutes to give you a few data, and I thank Dr. Voidazan. He is an epidemiologist. He is part of the team and does statistical analysis. As you see, we are a larger team, and we have allies, all those who contribute to this study. The questionnaire had 70 questions which related to diet, of which 55 of them are related to food frequency. Also, we're interested in smoking, sleep. Sleep is important, in obesity, exercise, how much time do they spend in the open, how long do they spend in the open, outdoor activity, stress level. Also, what is the interest of the population if we are going to start these educational programs in nutrition and exercise and quit smoking? Smoking quit, yes. I said that there are 1367 questionnaires gathered. 42% of the master's degree studies did more work. Also, those in the first, second and third year, the age of men was 40, 58 in children. The mean age was 40, 58 in women and 41 in men. What are the chronic diseases? 67% responded cardiovascular diseases. 63% are interested in a healthy diet. Which means you will have a lot of customers to work with. As regards the fresh fruit consumption, 20% eat them less than once a week, 32% between 2 and 6%, one every day 27%. As regards the vegetables, whether they be cooked, or fresh, the percentages range from 19.6 once a week to 39.5 2 to 6 times a week, or 31% once a day. Although these figures are not severe, there is a margin where we can intervene and improve. As regards the pickled foods, 34 people ate them less frequently, less than once a week, 2 to 6 times a week, 44%, and 24% eat them every day, which we know contain a lot of salt. Processed cut meats like sausages, the percentages vary from 39% once a week to 44%, 2 to 6 times a week, and 10% every day. I'd like to mention here that from what we saw, the population addressed by the students was a population which tends to have a higher social standard. And the other area addressed by the other foundation who helped us is a poorer area, so we expect differences between the two findings. As far as sweet drinks are concerned, also the figures vary between 65% once a week, 14% 2 to 6 times a week, and 10.5% once a week. Once a day, not once a week. You know that you need to question what people say about the data. We need to check these things, which we will more carefully when we start the second part of the project. As far as the smokers rate, almost 50% said they are or they were smokers, and 34% said that they never exercise 30 minutes, for 30 minutes. Maybe they do 10 minutes, but never 30 minutes. In conclusion, this program SOS Tîrgu Mureș of community intervention has started. There is no turning back. The question is whether you would join us. And you saw that it is never too late to join. And my special question for dietitians, students in dietetics, whether you will join in this effort of gathering the body of knowledge which should be the foundation of the profession in Romania. This is the beginning, but as you say in the United States and in America, only the sky is the limit. Once entered this field, you can invent and find many anything. There are many needs which are screaming out loud to us, but we should give our hands and act. Thank you. And this ends the first half of the day. We can go to have our meal. I forgot just one more thing. 1 to 2 minutes. I abuse of your patience. Have me excused. I agreed with Mr. Abraham Zoltan, the head of the hygiene department, to have a history capsule. Just 1 minute. I think that on behalf of the hygiene the department, we should thank our colleagues Talcea Monica and Dan Nicolae as organizers and the others, as we are here in a very successful meeting. And on the other hand, it is the opportunity of a sort of a baptism, as this ARoND association has been launched, and usually at the baptism you bring a present. We brought some intellectual products, so to speak, and I would underline, I would emphasize here the cooperation of the academia with the non-governmental organization, with the NGOs. I brought books from our discipline. I also, these are in Hungarian, but you have members and patients in Hungarian. I brought a T-shirt from an organization where I act. Maybe you will have T-shirts with ARoND. I brought some brochures.
Mai exact, de 15 ani, la 18-19 aprilie 1997 am organizat la disciplină, de fapt în colaborare cu...
In April 1988, we organized in our department a short conference about the perspectives of the education, when our guest was Mr. Dan Nicolae, and we went to Herghelia at that time, which had only recently been organized in 1996. Please have this brochure, and thank you for the organization. Thank you. Thank you, Professor. He's also my half boss because I am associated to the university. The nutrition dietetics subject is associated to the hygiene department, and he is the head of the department. Thank you. So enjoy your meal. We'll be back at 3. We'll have a shorter break this time.